person.
Works for me? Yep. You ready, or do you need a few more minutes to get settled? Melissa?
I'm good, thank you.
Okay. Well, being 5:30, why don't we go ahead and start up the meeting? Westborough TV needs a second or two to start. And I think first thing on our agenda is Superintendent Amber Bach and the School Committee Chair, Christian Vicen, and discussion regarding the DESE approval and masking. And I think before we actually have you guys start talking, I think that maybe we can just recap some of the COVID numbers that we have. I think I've got a little graphic, but if Alan has stuff he'd like to kind of add about that, that would work too.
First, I'll say I don't have anything to add to what you're going to present. I would like to just make a comment, which is partly in response to we received many communications from the community, and some of them reference some of the report that we issue each week. And I want to make clear that the part that is meant to put some of the numbers in perspective, I write a commentary about that. That is my personal opinion. I write it in the first person for the most part. And it's not meant to reflect the position of the board unless I explicitly say things like the board encourages all individuals to get vaccinated or things like that. So I distinguish between where I'm trying to shape something from my own perspective versus the board's position. And I want people to be careful not to think that what I'm writing has been endorsed by my co-board members.
Thank you. So let me go ahead and share this first slide here. What I have up here is the cases from Westborough, kind of averaged by day. And we have both the current year in blue and we have last year in orange. And one of the most striking things that we can see from this trend is that summers tend to be better. November, December tends to have a spike in cases, and this is the sort of trend that is common for respiratory illnesses. As people move inside, different dry air, lots of different factors, but all of these things are known to kind of cause this effect with respiratory viruses. And if we look at this year versus last year, one of the things that we can see is that there's actually a little bit more cases this year than last year. And if we look at the bottom, we have the data for the Worcester County area. And again, it pretty much mirrors what we're seeing here in Westborough in that, summers are better, that the winter tends to be worse. We can see this, the line that's in here is the actual 1 year ago. And you can see that the number of cases in Worcester County was less last year than this year also. So we have kind of those two different aspects going on. And then the other slide that I have was captured from a site at Wisconsin. And where they're actually doing sequencing, they're looking at all of the different variants that are around. And they kind of have it color-coded here, and I put some labels on here. Some of the original strains, the B1 was very prominent in terms of the percent of cases in the United States. We've gone through a couple of iterations of different variants of the COVID-19 or the SARS-CoV-2 virus. And what we're really seeing right now is the predominant, so this is July, August, September, and October. And what you can see is that the predominant strain right now is the Delta and the Delta Plus variants. And so each of the variants is a little bit differently. They behave differently. The early viruses that, the early variants that we had, really children were not getting infected by that. The Delta variants are much more infectious, and I do think that we have fewer hospitalizations, and there's been an increase in breakthrough infections, but both of those statistics are kind of confounded by the fact that we have a higher vaccination rate. And so trying to, tease apart that data becomes a little bit difficult, but obviously that's kind of the job that we're here to discuss. And so I think that with that as background, I think that it would be good to kind of talk with the school and, the school department with Amber and Kristen and get feedback from the Board of Health and try to have a dialogue here as we move forward. So Amber, if you wanted to come up, I think you have got some prepared stuff as well, or not?
Great. No, yeah, good to see you guys. I just organized a document for us to use for talking points, just to guide our conversation. Let me see if it comes up. All right, there's my nice, lovely desktop for you guys.
Looks as busy as the rest of us.
I know. That's not the one that should be coming up, though. That's weird. Aiden, I might need you to help me for a sec. Just
Well,
because
while you
I
get
don't
that
see-
ready, I don't know, Alan or Melissa, do you have anything that you'd like to add before Amber starts discussing?
Maybe because
I
my
certainly-
internet's not
I mean,
good.
I
Just
have
give
a
me
few
second.
things
The internet
to
was
say.
not
Do you want me
good,
to
so
say them
let me just
now,
get my
or do you
dock
want
up.
me to
Maybe
wait?
it's because
I prefer to hear what they have to say first, and then we'll
Sure.
react.
Absolutely.
All right, sorry. Let me just see if I can get this up functionally. My internet was down, and I think that it's weird. So why is it showing my desktop and not this? I need to call it mirroring.
Yeah. So it's in this.
I need to go into settings. Go to displays and arrangement.
Yep.
And mirror. Okay, thank you. Look how technological we are. All right. Just make this bigger. Okay. So, thank you. It's good to see you. It looks like you've blocked about a half hour for us to work together. So, as always, it's nice to be here with you guys. I thought that it looks like what we want to focus on is a chance to do an update and then a chance for you to provide feedback and guidance and information. So I thought that what I would do is take of that half hour, maybe 8 minutes, to step through a little bit of information, which is kind of a general update on process, procedure, how we're going to try to take steps forward, as well as some general thinking. I'm clear that all of this is in draft. We're at an early stage of opening up conversations with all the various groups that we work with. And then I figured I would take, like I said, 8 minutes to give you an overview, and then I would just give the remainder of the time to you to provide guidance, feedback, insights, and whatever comments that would be helpful for you to provide to us. Is that what you were thinking would be good,
Please.
Dr. Walsh? Is that
sounds
good?
fine.
All right. So, and I think it's good if I can just go all the way through it real quickly, and then we can spend all our time on you guys being able to talk and share. So it's clear that we have received that DESE waiver for both Gibbons and the high school, which is what opens the door for conversation and progress towards continued conversation of the many modifications we've used along the way with facing the pandemic. We do plan to move to flexible masking as it stands right now. We've reiterated that we will go very slowly at a reasonable pace in order to go far safely is a theme that we've really articulated to both staff, families, and to committees. I have confidence in our ability to move forward, and I want to reiterate that for all of us, that's been a process that we've used well through the height of a very difficult pandemic over the last year and a half. And all of our groups, I want to provide compliments to the process we've used, which is collaboration, conversation, and shared decision-making, however possible. So I started by providing within this document a quick snapshot of our current data, the vaccination at the two buildings. Currently, there are 3 unvaccinated individuals on the faculty side at the high school and at Gibbons, 3 each. Other than that, everyone is fully vaccinated and starting to rotate through their boosters. Of the students, this is data I believe that Jen Sullivan did present to you in a recent update that allowed us to apply for the waiver was the 85%, and you can see the numbers there, of the student body and 82% currently at Gibbons. So that's the data that allowed us to step forward to the waiver. Total cases to date since September, 3 faculty at the high school, 4 students at the high school, and you can see the notation there on vaccinations for those people, 5 at Gibbons and 1 student at Gibbons. So it's a current kind of snapshot of our first weeks of school. So I put in here a reference for the opening protocols which we've used. I think it's just important to step quickly through the process of the timeline which we use. We opened up discussion with our labor board, our school committee, our leadership team. I provided a community update. We applied to DESE. I came back to school committee and provided another update on receiving our approval. I booked meetings to come and update you. I provided a note to our colleagues on the faculty side and put out a feedback form to them to start to get information from them. I'm now attending here with you tonight on the 27th. Tomorrow morning I meet with the Parent Advisory Committee. I then follow up with communication, probably end of this week, beginning of next week, requesting the gap in vaccination information for all students, and I can talk a little bit about that. And I will be attending both labor board and school committee on the 2nd, ongoing process through discussion where I start cross-exchanging all the feedback we're receiving from all boards, groups, and committees. So that's very much a similar process to how we created our protocol documents last year and the close of the year before. We'll continue implementation forward from there. The 17th, the school committee then meets again. Again, it's important to understand that the school committee, as you guys do, could vote at any meeting. I noted the option to vote being a discussion point for them on the 17th because we will have moved through several meetings, but that's just a note. It's all draft. Consultation is with all of these groups that I've mentioned, as well as a reminder that for us the benchmark data here is DPH, DESE, CDC guidelines, Board of Health review of community health data, and then the other groups that I've just mentioned. So I feel like this is such a familiar path, a discussion that we've shared now for quite a while. And so I think I would move into, again, what I mark as an early implementation guidance. The goal in providing guidance is to just shape conversation. I don't want to be here in any way to represent anything that can be misunderstood to somehow be decisions. I think it's very important to realize those aren't, but we do have a set of practices and protocols that have guided us over the years, and talking to area superintendents and emerging plans, it just gave me an opportunity to draft some things for you to respond to. So expectations we see moving forward. Again, using data as that guideline, we feel we are safe to move forward. Westborough is a safe community with impressive levels of both vaccination and a limited caseload. I recognize that I'm saying that and that you will continue to provide data on that. You have always been the anchor organization we've used for that data, and I think that's grounded everything we've been able to do together. Frank discussions around the numbers and looking at where we are in our community level. So I would see that general expectations I drafted would look like all students and faculty must have a mask available at all times. Unvaccinated individuals must remain masked indoors. Students will wear a mask on the bus until DESE guidelines or state guidelines were to change. All students and faculty will encourage a school culture supportive and respectful of flexing masks. That's respect for anyone's decision to mask or flex mask and will be supported. Many reasons exist for why a person would select to mask, and everyone will be respectful of privacy and personal choices. I pride the faculty of Westborough and the community at large of being a caring and cooperative community, and I think we've found that implementation of all of our protocols along the way and creating environments of both emotional safety and physical safety have been an important priority of our success. And the focus on mental health, all of that remains as an anchor for anything we do moving forward to make sure that students and faculty feel that the environment is both accepting and safe. As a values-based district, we will make every effort to both respect the privacy guidelines while monitoring mask wearing for those who must remain masked. We fully expect we will see flex masking for a wide range of both faculty and students based on individual choices. Special circumstances for masking. These are the areas where last time we hammered out a lot of details working with our faculty in a collaborative framework so that they knew their voices were heard in the environment in which they work. If flex masking becomes available at that school committee or at a future one, students and faculty would mask the week after Thanksgiving for that 5-day window. That follows, and we had 2 splits on that recommendation. It mimics some of what we did around the hybrid, where after a vacation we did 10 days, we did 2 weeks remote. We did that for one vacation, I think fully supported that you felt that was responsive, and then in the spring, we split. I stayed at 2 weeks remote, and you felt we could be in school. Similarly, I imagine there will be a range of opinions around whether or not the responsiveness of masking post-vacation blocks, is a part of this practice, so I model it in this draft as a point of conversation for both faculty and you guys. Any faculty or student will respectfully mask if requested by an administrator. Theater and fine arts events will continue to require audiences to mask, and that won't be reviewed until January. We've already done several concerts and followed a protocol that seems to follow a guideline that is logical, and we would maintain that. Other special events will be reviewed and planned by protocol with discussion with either the director or consultation from the chair. Using a very specified set of guidelines outlined by human resources and the nurse leader, some classrooms will have approved masking guidelines for limited documented medical circumstances related to students or faculty needs. This echoes a practice that we utilized as a way forward in collaboration with our faculty. We had a range of faculty who applied for, based upon medical documentation, a flex to their work environment, either to work alone, to work remotely, to take a year off. There was a whole array of responses, and those were complicated protocols, but we moved through them systematically and respectfully through the HR HIPAA-based process, and were able to put practices in place. Similarly, I would imagine we would have the capacity, I know we have the capacity to thoughtfully respond to students or to faculty for parameters for additional masking in a classroom or at a table group or at a meeting based upon what we know to be medical need documented and decided upon. Examples would be masking at a shared table group for a specific spacing for a student, or masking a classroom if necessary based upon a medical need of a teacher or of a student, masking to hold one-on-one meetings based upon the needs or questions of the faculty member for an up-close meeting. Those are the types of parameters that the safety committee utilized, and then we checked with you kind of for practice and protocol along the way to make sure that we were both doing something that was as limited and cumbersome as possible, as streamlined as possible, and grounded in data that was based upon a rationale that we felt we could present to faculty as fair and based upon medical or data-based evidence. So those are the rough parameters by which I opened up, the start of conversation. As I said then, I'll be circling back through all of these groups. You're the first. I sent this document to school committee last night, and they gave me some feedback. So just a starting place to frame our conversation. I would open it up to you. And again, I would reiterate, we see all of this as a process where we are in relationship with all of those groups to move forward as collaboratively as possible. So I would open it up.
Thank you. I'll let either of my colleagues go first if you want to ask any specific questions or make other comments.
Contact tracing, if you were to do, optional masking, from what I've read, it's recommended, contact tracing is increased to the 6-foot distance. And to me, after being in open house and experiencing many classrooms, that seems like it would be incredibly challenging. So I don't know if you want to comment on that.
Currently, our classrooms are at a range, and we were clear at our opening protocols, 3 feet when possible. We're actually at 3 feet at the end of last year. So our classrooms are spaced at the end of last year, we were at 3 to 6 feet. And in many of our classrooms, that was the protocol that we closed with. We opened with that this year, 3 feet when possible or larger. And we have all our students back, so it changes, the dynamic. But contact tracing, actually, the protocol we used last year and this year pretty much remain the same. The call protocol currently is 3 feet. And, if the discussion point is that you wanted it to be 6 feet, we just go back and look at all of the guidelines. Is that what you're saying? Or
So
just
I think
I'm
asking?
saying if they're not masking,
Yeah.
I would assume contact tracing is quite different if they're not masked.
Um,
From,
I'm not quite sure I understand your question. How is contact tracing different? Or just, they're obviously going to
If
continue
children
doing
are
contact
not
tracing?
masked in the classroom,
Yeah.
I have been told by specialists that the distance is 6 feet.
Yep.
And, but I was also thinking that would all be more challenging if they're all unmasked or
Yeah, no,
majority
yeah,
unmasked.
yeah.
So,
So I think what I want to do is make sure I take notes currently, and I told Judy she could text me, she's watching too. Currently, we trace to the 3 feet guideline, and that's the practice that we've been using, although it's not just 3 feet, it's extended periods of time together in small groups. I mean, those are the protocols we were using at the close of last year and felt that they effectively helped us, circle and contain our contact tracing. We certainly, at this point, I would anticipate continuing that, but I'm just going to say,
So if I
I'm
could
just going to note
jump in
it.
and maybe provide some clarification. I think that what Melissa's asking or saying is not that the current protocol is bad or needs to change. It's that protocol is acceptable while people are wearing masks. And then if we were to go to this flexible masking policy, where now somebody that's not wearing a mask and is now within 6 feet but more than 3 feet of somebody that's a confirmed case,
No, right, yeah, yeah.
we might need to adjust our contact tracing protocol as we go to look at adjusting our masking protocol.
Yeah, I'm certainly, no, I understood, and I again, I want to be
Is that
clear,
what
we're
you were
using
saying?
3 feet. I'm not, I understand the question, yeah, and certainly for consideration. I mean, with your vast majority vaccinated, you're basically identifying and then monitoring for symptoms. So, it ends up being somewhat of a moot point, but I'm certainly open to looking at it. It just, you're identifying a larger circle. You say, watch for symptoms. I think typically we've been using a wide array of just generally reminding people to be aware and track for symptoms. But yeah, I'm certainly,
Well-
thank you.
if a vaccinated individual is exposed, they do need to mask if they're going to be in school, and monitor for symptoms. So that would be a much larger group of children that would then have to be coming to school masked for a certain number of days. I'm not sure what the current guidelines are from DESE on the number of days, or
Yeah,
can they test out of that like
Yep.
we are doing in the community? But certainly
that's
anybody
great.
who's been exposed, even if they've been vaccinated, then needs to mask in the community. And so I'm assuming if kids are exposed and do return to school, they would need to mask.
Right. This is good. Keep going. We're just going to develop a list.
Yes, so, one thing that I think has been a real strength of your leadership and how things have gone has been focusing on data and having data-driven decisions. As you've put together this plan, have you thought about what would be your approach to reviewing the data? I know many people are concerned that if there's lack of mandatory masking, that it might increase the risk of outbreak.
Yeah.
What protocol would you have for monitoring the data and going
Sure.
forward?
So interesting. You should ask Dr. Ehrlich. Here it is, right here. So one of the things that we did do exactly was ground our discussions weekly in a data protocol. Currently, these guidelines that I'll show you are the guidelines that we used last year during the height of the pandemic to guide our decision-making and were approved by you and school committee and implemented together. That protocol is the one we are actively using today in these circumstances as well, with our call protocol, our follow-up, and our weekly maintenance checks based upon data. So if we look at the recommendations we utilized last year, I am recommending that we would, as we move forward to flexible masking, maintain this same protocol. That protocol involved working with you in consultation with the Board of Health to use the tracking system we had in place, which is a weekly or necessary, I mean, you and I sometimes spoke more, daily to check in if we need an interpretation of responding to the data. One of the things that the board developed with us that I think was very helpful was this is point D, collaborating with the district to analyze by school, local, state, and to respond determined upon such actions that we didn't set a metric. What we did was respond by the case definition. We looked at a classroom, a building, and took them case by case and then modified as needed. That current practice guided how we responded at Mill Pond as well, sought consultation, used protocol responses from our past work, and then were able to kind of move beyond that outbreak number. So I would recommend this continuing to be the protocol that guides us, and that was really a daily tabulation and a weekly posting, and then a call based upon that correspondence, like, hey, I think we should, circle up with the chair and look at this data and get some guidance based upon what we saw in the numbers. So unfortunately, that means a lot of contact with us, but I think we try to keep those conversations focused. Our nurse leaders are very, very good at calling, sharing the number, updating on the protocol of response, and then getting a confirmation like good to move forward or, make this modification. So that's my proposal in this draft for how we would move forward.
Thank you.
Yep.
So I had a question about the flexible masking in terms of the implementation. In terms of if there's a classroom, how do you know which kids are required to wear the mask? How do you know which ones aren't? And if I reflect on my past, which is going to date myself, but back when I was a student in school, we had something that was called a Max Ed card. And basically on that card, you could have a parent sign saying that you were allowed to leave the school grounds during the day. I think there was even a line you could have your parents sign if you were allowed to smoke. Obviously, times are very different now.
Times have changed.
But what we had is parent involvement in some of these decisions. And so I'm just kind of wondering how you would implement this sort of policy, especially if, let's say, parents decided that they wanted their kid to wear a mask, even if DESE said they didn't have to, even if the child might, not want to wear a mask. How do you kind of involve a parent in these decisions?
Sure. So, not unlike how we involve you in educating your children all the time, there's a range of collaboration and information sharing. If you look at, these two bullets here, I think that, there's a tension between respecting the privacy guidelines of information around vaccination and running kind of invisible protocols to make sure that we're keeping track of things. I think it's something that schools are particularly skilled at. I'm currently, talking with the nurse leader and the admin team about how we would be able to loosely monitor that and do spot checking around students who need to remain in masks. I think all of our faculty are clear that a parent desire that their child remain masked would be certainly something they can share with us. We will do our best to do reminders, but all of our faculty are clear, like they do not want to be daily policing the parent list of, preferences for masking. I think it would be certainly a piece of the survey that we send home, which we did before, which is we would be asking, like, I'm comfortable with my child plus masking, yes, they're vaccinated, or I'd prefer my child, continue to mask. So we'll definitely collect the data, give it a look, and then, respond with a framework of, you need to work with your student to be clear on your family expectations. And, I think we're going to be focused on the embedded must mask and practices that allow us to respectfully monitor that.
Do you have some more questions?
I have some comments
Sure.
if this is a good time.
Yep.
So, I absolutely respect, all the work you've all done and how well our schools are doing. And, the vaccination rate in Westborough is very good. I do think it could be better. There are some towns that are doing better than us. It would be great if we could get that number even higher. I also want to thank, the parents and community members who did take the time to send us emails. There were quite a few of them, including some local physicians. And so I do have concerns about flex masking and optional masking, and I did want to mention a few things here. DESE came out 2 days ago, as we all know, basically stating that the indoor mask requirement for Massachusetts public schools will remain in effect through January 15th, unless the school has applied for a waiver and been approved for a waiver. Basically, they consulted with experts and state health officials, and the education secretary and commissioner came out and said that they want to allow time to get more children vaccinated, which hopefully will be happening very soon with the elementary school age children, and get the numbers down in the state. Most specialists agree that indoor masking in schools is important when daily case incidence rates is greater than 10. Currently on mass.gov, you can see all case incidence rates, daily case incidence rates. Right as of last Friday, Westborough was at 26.7. Just to compare, Southborough was at 14, Hopkinton 20, Shrewsbury 17, 20, Worcester 22. And just as another example, Cambridge was at 7. So basically, average case daily incident rate is cases per population of 100,000 per day. Although Westborough applied for the waiver for optional masking, due to our vaccination rates of the high school being 85% and Gibbons at 83% or something.
Yeah.
I'm recommending that we wait and continue following guidelines from the CDC, the American Academy of Pediatrics, and now DESE. I recommend we wait until elementary school children ages 5 through 11 can be vaccinated, until our case incidence rate is under 10, and until we have more vaccinated students and teachers. Furthermore, while the vaccinate rates are great in Westborough, we don't live in a bubble, as we all know. So children in our town are socializing and playing sports with kids from many surrounding towns, which their incidence rates seem to be doing pretty well right now, but they're doing better than us right now, most of them. As we know, masks work. Masks decrease transmission. Our school is doing great, and it's wonderful. We know masks protect both parties. With winter coming and more gatherings going inside, holiday season, we're likely going to see increased transmission. While I appreciate, you talking about what was done last year around this time, and I'm concerned that, with Delta being a very different virus, and very much more transmissible, yet we also have vaccinated kids. So, it's very different, in my opinion, from where we were last year. Our students and teachers should feel safe going to school. Kids have to go to school, other than kids who are homeschooled, private school options, of course. One parent wrote in an email, and I thought she said it better than I could, is all children have the right to go to school where they feel safe, and all children have a right to an education where their health is not put at risk by others. This is even more important for our immunocompromised students or students for whom the vaccine is less effective. So, basically, based on those reasons, I do feel that we should wait. And I think some of my other questions you've already answered, and I don't know if anybody has any other things to say.
Dr. Ehrlich?
So I too want to thank everyone who sent in emails to the Board of Health. Some had gone to the school department first and were then forwarded to us, and I think I speak for all of us when I want to make clear I read every single one of them. We take that feedback very seriously and we appreciate it. And so some of my comments are going to be directed at that correspondence. One of the things that sometimes comes up in this discussion is people will feel that if someone has a different perspective, they're not following the science, and that goes in both directions. And I want to say that I don't think that is really a very fair argument to make in this situation. One of the problems with COVID is that we have limited data. The data is imperfect, and so people are making judgments to the best of their ability with what data exists. And reasonable people will often look at the same set of numbers and reach different conclusions as to what policy action should be taken. And that's partly because they may have different values that are reflected in those decisions. Two papers were cited in some of the correspondence, both now and some earlier correspondence, and they're both from a publication put out by the CDC called the MMWR, Morbidity and Mortality Weekly Report. And they addressed the issue about transmission in schools. There was one earlier this year about public schools in Georgia that looked at data with respect to November, December of 2020. And then most recently, and this made some national news, there was data coming out of Arizona relating to policies that were in place at the start of their school year, which begins in July, so for July and August. And what I want to mention is that both of these articles are limited in what we can draw from them. In the case of the Georgia data, this was done at a time before vaccination, so we don't know how that applies post-vaccination. That data showed that masking of staff seemed to result in lower rates of incidence of cases in the school, and masking of students did not make a statistically significant difference. Now, it actually showed lower rates in students who were masked, but the confidence intervals around that were such that we don't know if that's a real finding or a chance finding. So just pointing out some of the limitations. Again, this was mentioned in one of our earlier emails, which is why I wanted to just discuss it briefly. The Arizona data shows that schools that had a masking policy right from the get-go had fewer what they called outbreaks compared to schools that adopted one later or never had a mandatory masking policy. The problem with the Arizona data is they don't analyze by whether students were vaccinated or not, or what the vaccination rates were in the schools. And their definition of an outbreak is 2 cases of students having COVID in the school within a 14-day period. And so, that broad definition of an outbreak, I think, is somewhat different than how I think about outbreaks as we've discussed them in town. It doesn't speak to school transmission or things like that. So this is what I mean when I say people can look at the data and get different interpretations from it, and we have to be respectful of people who interpret things differently from us, and I try and do that as much as I can. I want to follow up on a point that came in many of the emails, and Melissa, you raised it, around the 5 to 11-year-olds who hopefully will be eligible for vaccinating in the next week or two. But right now, they are an at-risk population. And there's concern that many of the people who go to Gibbons or the high school will have siblings who are in that age range. And I guess my question is, it's also certainly possible that they're going to have siblings who are under 5. And if the 5 to 11-year-olds are vaccinated, would you be concerned about not masking because even there'd be another cohort that is still vulnerable? And so what I think it's important is to try and lay out what is the parameters by which we might feel comfortable with one policy or another. I know you two had asked me previously when we were talking about the town buildings policy, and I guess my question, particularly for Melissa because she spoke first and you haven't spoken, Nathan, is, at what point would you feel comfortable that the masking could go away?
I mean, I think once we vaccinate a significant portion of our 5 to 11-year-olds, that will raise our town vaccination rate even higher. And, decrease our case incident rate even more. So, I mean, I'm not looking at it in that sense. Well, I know a lot of specialists are using that as guidance. Yes, we want to vaccinate our 5 to 11-year-olds, and that certainly is going to help the overall numbers, in my opinion. I mean, I'd like to look at the overall numbers and give some hard numbers for guidance. And that's why I keep mentioning the case incidence rate and the vaccination rate. And I think, the vaccination rate is going to go higher, and I think the case incidence rate is going to go lower once we start vaccinating those kids. And it will also make parents feel more comfortable sending their kids to school. I mean, the thing about an under 5-year-old is they don't have to go to school. So,
no, but I mean,
yeah.
That's true, but one of the things that has come back, we've heard, is there are breakthrough cases, which we expect that will be breakthrough cases at the high school if this policy is implemented. I mean, there'll be breakthrough cases even if it's not implemented. But the risk is that there might be more, and that they're going to come home and expose people at home who aren't, in that school environment. And my point is that applies equally to those under 5 who aren't in school as it does to those who are in school.
Yes, I see your point. Again, I think it's just a large chunk of individuals and get our numbers better. I mean, would I want to keep masking until the under 5-year-olds are vaccinated? I don't think that's going to be an option, to be honest. I don't even know how soon that would be an option. And I would just want to follow the data and follow the guidelines, so I don't know if I can answer that.
So I'd like to make a couple of comments as well. One is, in the emails that had come in, as Dr. Ehrlich had said, that we've actually had a lot to read this week, much more so than we usually do at our meetings. And so I've also read through all of the comments that came in. And one of the things that I wanted to comment on was this notion of herd immunity, because it was referenced a lot of times. And herd immunity is basically the point at which an infection is going to start to die out in the community because it's not transmitting as fast as, new cases are less than the number of people that are recovering from the disease. And herd immunity has a couple of different components. So obviously there's just people's natural immunity. There's the vaccination rate in the area. There's also the vaccine efficacy. And so if vaccine starts to wane, it's going to change, the herd immunity. It's also going to be dependent on the policies that are in place to reduce exposure. It's also going to be dependent on actions that people take in order to reduce exposure. And so if at any given point in time, the Board of Health has said that it looks like we might have reached herd immunity, I want to be clear that that's in this larger context of all of the policies that are in place, all of the actions that people are currently taking. Certainly at the height of the pandemic, the actions that people were taking to keep themselves from being exposed is very different than the actions people are taking right now or maybe at some future point in time. And so herd immunity is not something that is just based on the vaccination rate. There's other complications, more nuances that do come into that. And, the output of this is how many new cases are we seeing? Are cases in Westborough going up? Are cases in Westborough going down? And right now, when I, look at one of our reports, it's usually a 7-day time period that we're generating these reports for. And, when we're at the point where there's, 2 new cases a day, there is still a very big difference between what is happening with those individual cases. And so you could imagine the extreme where those 2 cases require hospitalization and lead to death. And there's also the other extreme where they have mild symptoms or maybe asymptomatic and they just, they're positive test rates. And we have a lot of respiratory illnesses in our community, adenovirus, rhinovirus, lots of different ones where they don't typically cause a lot of symptoms or a lot of problems. And so if we were testing for those, we might find that they're actually endemic and that we, have them and that those cases would be there. What we worry about are those times where these lead to severe complications. And so flu is one of those ones that have a tendency to lead to much more severe complications. And of course, the SARS-CoV-2 is another one of these. The COVID is also likely to cause severe complications in some people. And as we roll out vaccines, it does help a lot of the population that is vaccinated. My personal feeling is that while 85% of the school kids being vaccinated is good, I don't think it's good enough. I really would encourage people to get vaccinated if they aren't vaccinated, and that goes for the adults as well. I think that when it comes to boosters, I would also argue that we should be vaccinating. But I do want to just make clear that it's not a one and done. It's not the vaccine alone is going to provide all of the benefit that you will ever need and then you never have to worry about it again. We try to layer on different types of procedures so that if something is not working, there's some other safety net to help catch it. And that's, masking is one of those examples. Trying to maintain spacing is another example. Trying to reduce the crowding, try to, be outdoors rather than indoors. And that's why we talk about a lot of these things, is because it's not like any one feature is the perfect solution. It's to try to bring all these up as much as possible. And so I do want to encourage people to get vaccinated if they are able, get boosters if they are able. And, I think I probably have some more feelings about, what we should recommend as a board, but I also want to give Alan a chance to make some more comments as well.
Well, first of all, I want to just say I agree with everything you said about herd immunity. And I know in some of my comments some of my commentaries I've mentioned that, and I have not intended to in any way indicate that people shouldn't still be concerned about COVID. It's just looking at numbers at a certain point in time, what do we think and what kind of progress have we made? And to a certain extent, we should be proud of the progress we've made. But nonetheless, I agree, the 15% of the high school students who have yet to get vaccinated, I would urge every one of them, unless they have some very, very specific contraindication, to get vaccinated as soon as possible. I know we've covered a bunch of subjects this evening. We've asked the school committee, they've wanted to meet with it, for our advice.
Yeah.
My feeling is that if there's a clear health concern that we can point to that would make us strongly feel one way or the other, then we should be giving our recommendations to the school committee and Amber in terms of what's being done. If you have, and again, I know many people cite the CDC and the American Academy of Pediatrics guidance is pointing in one direction. On the other hand, you have DESE who said, well, if your school meets this criteria, you can go in another direction. And my feeling as a Board of Health member is, while we can sort of weigh in on what we might choose to do, there's a lot of other factors besides COVID that come into play in terms of this decision, in my opinion. And it involves other things like students' mental health and psychological well-being and things like that. And the people who I believe are best placed to balance the competing issues are the school committee and the superintendent. And so if they're going in a direction that I think is unsafe, then I would want to be telling them that. If it's a situation where we might have a different opinion, we can express that, but I still, at this point, based on the data that I see, my feeling is I respect their right to make that call because that's their role within the community.
So I have another question actually for Amber or Kristen, and that is, related to kind of the earlier comments that you had made about, how would you enforce it, and that you might not want the teachers to be the ones that are, trying to keep lists of people to figure out, who today is allowed to wear a mask and who isn't. I worry a little bit about that enforcement policy, but I also, am just trying to picture how this gets implemented in the sense of, imagine a class where half the kids wanted to wear the mask and half the kids didn't. Would you let all the kids who thought that masking was important for their safety to sit near all the other kids that are wearing masks? And, or is it that people are, someone has to sit next to someone who is not wearing a mask, even if they think masks are important? How do you deal with a lot of these issues that are going to come up? And I worry that if you put in a flexible masking policy and there's no real, guidelines for how does it get enforced, and that, you kind of are going to set up a situation where some of the students could actually get very anxious, very nervous about, their environment. I think some parents are going to worry about the environment. I do think that on the other extreme is, or on the other side, there are people that think that this is a burden, that it's not, much of an issue for them. They think the risks are lower. I personally think that, people should be wearing masks in any situation where they feel that is risky, but everyone's definition of what is risky varies a little bit. And so I've got my own personal, perception of what I think is risky, and I wear my mask in those situations, and there's other people that would look at that same situation and deem that as not risky. But I just kind of want to hear a little bit about you as to how you envision this being,
sure,
actually put in place.
I mean, I think that the last year and a half to almost 2 years demonstrate our capacity to manage complex situations. So, and I don't mean that in a flip way, I mean that in a respectful, shared way, which is we've done nothing but live complexity at a very high level for the last almost 2 years. Beyond that, it's our industry job to manage large group of students and create flexible, safe, and invisible safeguards built into the environment. And I think Westborough is a top-notch, highly professional staff. There's one of the most caring group of people with regard to being respectful to students and their rights and creating environments where they feel safe and supported. So I have complete confidence in our faculty to implement an environment of flex masking. Our students typically at Gibbons in the high school sit where they want. So, students have, we also have classes at Gibbons where there are assigned seats. It varies. But, we're there to be, again, I think I'm very confident that a flexible environment where students feel comfortable and faculty, flex masking is easy to implement for them. I think it's grounded in respectful discussion, and our students are good about advocating. If they want to sit somewhere, they tend to cluster, where they want to be anyway, in class so that they can learn effectively. So I don't have a concern about that. I mean, typically the safety committee that worked through that granular level of detail, it's an implementation practice, asks and answers those kind of questions utilizing the principals, faculty, and nurses. I think that in terms of, your insightful comments around student feeling, and you have gotten a wide array of voices. Sometimes those voices, and in many times represent, a parent's voice might represent their student and their family values and the practices they have. I want to give a shout out to our students who are some of the most highly respectful and caring young adults I've ever had the experience of working with in my career. And they're doing what we ask of them because we ask it of them. That doesn't mean they want to be doing it. And their mental health is a piece of this, and there are students who want the flexibility to mask and do see it as anxiety provoking as some students who are anxious about having to take that mask off. So providing a culture and a support for both is how I've based my career, which is to create as flexible and sustainable an environment where every person can thrive in their best identity for what works for them to learn and grow in a safe environment. And so I see the opportunity for flexible masking is to address that bell curve, which we have talked about for a year and a half. You're going to get 20 emails that are intense on one end and 20 emails that are intense on the other, and reality lies in the middle in the implementation of complexity. And that's what we do. It's what you've done with us. It's not comfortable, but it's necessary. I have confidence we'll see our way through it, but my goal is to represent that complete bell curve of both faculty voice and student voice. Parents are a piece of that, and I respect their voice to share that forward as well. We have a lot of constituencies, and we have to look at all of them. But the practices have to try to meet in the middle for as many people as possible. So well-implemented flexible masking is probably the next step forward for us in this state of living. And at some point we will face it. And I think the process is going to have to take those steps. So, I have confidence that we'll find our way. I think the other piece, you mentioned, which was worrying about enforcement. We're a high school and a middle school. Our whole life is enforcement, but one of the things I like is the respectful way we do it, that it's mostly invisible.
Do you have more comments or questions?
Just one thing that maybe was touched upon briefly is the timing of this, timing with holiday season coming up, with the winter and respiratory illnesses going to increase. We're already seeing that. So my concern also is, with kids getting more respiratory illnesses, if more kids are unmasked in schools, that's more kids needing to leave school to get tested for COVID, missing school, and so I foresee that as a problem as well.
Yeah, potentially. I mean, I think those are all factors that, again, that one of the things I think that is important to recognize is we're at the stage where, I guess it's maybe like a little battle worn for me on this, to be honest. The levels of implementation it took for us to get open were so much more complex. For me, managing the step towards flexible masking, it can flex a lot of ways, and the data will guide us. If we see a change in that status and we're speaking with you, we have the capacity to respond to say, take your bag and get your mask out and put it on. We have an implementation flexibility at this phase that wasn't a piece of the complexity before when we were designing everything else, the HVAC systems, the protocols for cleaning, the separation of kids, like all of that, had an immense complexity. We're actually at a phase where I feel like we have one data point we're working on, and the data will give us the capacity to flex with it back and forth. That flexing is inclusive of you and the guidance of the data. If we see a change that you find concerning, it will be responsive for us to come forward. I speak to Jen pretty much a lot to check in, and that protocol will carry us forward. So I'm not afraid, but I'm cautious, and those are different things.
Yeah, I think some of the points you're making are very important, and one of the things I would say is that if you do go in the direction of this flexible masking policy, that as that gets communicated out to the community, to the parents, that it be made, crystal clear, even though this is part of your plan, but it be very explicit that going back to full masking is data dependent, and it very likely could happen, and you don't want to have a bunch of people who are saying, well, you said we could stop wearing masks, why has it changed? It's going
Right.
to change if the data so indicates.
Yeah, no, I appreciate that. I mean, I feel like that's my life now. I mean, we are responsive to you'll get blips of it. There's always a strain around, input around differing perspectives. We have athletes, layers and layers and layers. So yes, I certainly think that we'll work to be explicit that the discussion of how well it goes, grounds how we move forward. Hopkinton's starting on Monday, or the 1st, I think that's Monday, with 3 weeks of a trial. And they're going to look at their data. I'm like, well, that's how it's got to be all the time. You've got to be able to look at the data and step forward.
From what I read, Hopkinton has a 98% vaccination rate. Is that what, has anyone else known?
I won't speak to their
Okay.
data. One of the pieces we didn't
Seems
touch
very
on
high.
tonight is, there's probably, if you look at the percentages, about roughly 95 students at Gibbons and about 175 at the high school, where we need to confirm their vaccination status. That's the gap in the SNAP data. We fully, have confidence that we'll have a higher percentage vaccination rate. We applied with the lowest percentage, of the absolutes, because I wanted to be comfortable that when I was submitting to the state, that the number I was using was in SNAP, confirmed through nursing, and a protocol that was, nobody telling me they're vaccinated when they're not, right? So we submitted data that we thought was solid. I think we have, then there's different vaccination places. Walgreens doesn't put all their data in. So there's a gap we have to answer, and that would be done on a student-by-student basis. The nurses are looking at a protocol for that. So, and then student by student, you're encouraging those to ask about vaccination. Is it a selection not to, or is it because they haven't been able to? That's a process of nursing that's pretty much, part of this. I think we'll be at a higher percentage.
So let me now just provide some of my comments, and that's that while we're in a state where we have, or not like Massachusetts, but in the conditions where we have cases actually in the schools coming up occasionally, we have it in town, and especially where those cases might be increasing, which is what I would expect in kind of this November, December timeframe. When we're talking about indoor spaces, spacing with kind of less than 6 foot distancing, especially where people are next to somebody else for more than 15 minutes at a time, and especially when the rooms are fairly crowded, used at more than 50% capacity, that's kind of the situation where I would view that as risky, and they should be wearing masks. And whether it's the schools or any other, building that's out there, I think that's where I'm leaning, is that would be my recommendation in those situations. You should probably wear a mask. And I'd like to hear the other board members' kind of opinion as we move forward, so that we can kind of give a view of the whole board to the school department.
I think that it definitely is important to get numbers for vaccinated students. I think that's, great to keep working on that and get our true numbers, absolutely. But I really would like to see that number higher, and I would like to see our town number lower before flexible masking. I do think it's important, yes, to look at the schools directly, not just the town, case by case. But I think it's also helpful to have, definite guidance too, and rather than just doing it case by case. So that's why I'm trying to give those numbers, whether it's the higher vaccination rate and the lower town numbers before doing it. So I am recommending we wait.
So as I indicated before, I think that there are competing interests, and that while masking, I believe, does reduce the risk of COVID, the magnitude of that benefit, I think, is small. I didn't quote this earlier, but I'll just mention from the Georgia data this was over the course of a course of 26 days, so about a month worth of time. And having students masked versus not masked led to a difference of about 1.5 cases per 500 students in the school. So, so you're talking about going from like 3.5 to 2 cases per 500. So it's not a large benefit, and a lot of it has to do with what's the prevalence in town, and what's the efficacy of the vaccine, and what's the virulence and transmissibility of the virus, and all those things come into it, because the Georgia data was not about the Delta virus, and I sort of stipulate that the Delta is more transmissible. But, you know, we have not seen, even where we've had cases in Mill Pond or other places, that it has led to a significant spreading of disease throughout the whole school or things like that, that I feel like you contribute some of that to masking, but it's attributed, as I think you had indicated, to a whole range of policies that are taking place. And some of it is the community vaccination rate that makes it harder for the disease to spread once someone gets infected. My feeling is I'm comfortable with what the school committee is proposing on a trial basis. I trust that there'll be close monitoring of the data, and that I don't think, while I would certainly be the first to say that there's some risk. You may have an uptick of cases, you may have in-school transmission if you do this. On the other hand, that may not happen, and you may get some benefits from it. And if, as long as we're carefully monitoring the situation, I don't think it's reckless to go in that direction. I think it's something that we're going to have to do sooner or later, and if we do it in a way that is careful and thoughtful, then I'm okay with the approach, and I think what the superintendent has laid out meets that standard for me.
And so if we have, I think in the last report, there were 30 cases. And so if that number is going up, I would argue that that's not the time to be rolling back, policies that are in place. I think if the number is going down, that's actually a good time to start thinking about, do all the policies we have in place need to be changed? And, I'd say that for the past month or so, we've been hovering around 30 cases. And so
Bouncing around. Right?
Bouncing around, yeah. Some weeks up, some weeks down. And so I wouldn't just, based on any one week, but that's the sort of, concern that I have is if the cases are going up, we really shouldn't be implementing, policies that are, relaxing some of the standards that we have. So I don't know, Melissa, do you have more comments? Or, it doesn't sound like we're
No,
going to have
I personally like to look at the case incidence rate. I know I keep repeating myself, but 30 cases, you're talking about a population of 20,000. It's, in my mind, it's a lot easier to look at the numbers as a case incidence rate so that you're taking away population numbers and you're able to compare from town to town. And again, a lot of specialists, experts recommend that number to be under 10 to recommend indoor school masking. And we're not there. We're at over 26. So it really, in my opinion, needs to be lower to take masks off in school. These kids are sitting for long periods of time, next to one another. If you do, go ahead with this, it's obvious that some of us are not recommending it and some of us are. I would recommend considering masking in the hallways. I've walked through the hallways in the high school. I haven't been in Gibbons in a very long time, but it gets very crowded. And I understand that when you're walking by people or walking next to people, yes, it's not 10 minutes, 15 minutes. But I would wonder if it has been considered, mask in the hallways and not in the classrooms, that kind of thing. But I'm not recommending we do that right now, but I think if you all are gonna go ahead with it, I would want that to be considered.
So one of the things, just to comment on the time exposure versus, passing in the hallway, if the number of infected individuals is high enough that for every one person you come close to that's infected, who then leaves, a new person kind of comes near you, that's at the point where then it doesn't really matter about how long the exposure is, because there's always new people coming in as leaving. The reason why we worry about the kind of that 15 minutes, especially a prolonged contact, is that no matter what the rate of infection in like Westborough or in the schools is, if you happen to be next to that specific person, then you have this prolonged exposure to them. But in the schools or in the hallways, I'm actually a little less concerned about that exposure. I mean, now granted, the hallways are very crowded from what I hear. I haven't been at the school during passing time, but the overall rate at which students are infected in the school is pretty low. And so that one person that you might pass, you're actually going to have a very short exposure time with.
Well, I know, I was thinking more of the group of kids moving together, but I see your point, I do. And,
If I could add one thing, which is, when you're talking about other things that you can do that would make a difference, in my mind, the thing that needs to be emphasized over and over again is, if someone's sick, they don't come to work and they don't go to school. Okay, that will do as much as anything else. So that we've had a culture in the United States where people, they do show up when they're sick because for any number of reasons, and that needs to be made clear that can undermine this policy if you go forward with it.
No, thank you. I think people, informally I would report, I think are being much more vigilant around staying home when there are symptoms. So, and I think some people are still under the opportunity to flex work, more so than they were in the past. I mean, clearly the data is driven by two-income families, and the necessity to go to work has always driven the fact that we're in the business of, keeping families moving forward, which we recognized right away in the pandemic when we shut down.
For Gibbons and the high school, the students are at an age where they can be left home alone if need be. So. Yeah, I think they're the ones who want to come when they're sick. But yes, they are being better about it. Thank you very much.
Thank you, Amber. Thank you. I don't know, Kristen, did you have anything to add?
No, thank you, though. Can I add something?
What was that?
Can I add something?
Please.
So I know that you like to look at the number as a whole, but as someone also that's been involved with the pandemic since it began, it's very important for me to look at it individually. And I can tell you that Amber and Judy and the nurses look at every case individually on how it happened, where they're getting it from, like actual contact tracing within the school, outside of the school. They do a phenomenal job. So I think the cluster, as an example, that happened at Mill Pond was stopped so quickly because of their due diligence on looking at each individual case closely. So I think, yes, we do need to look at the number, and I appreciate that you do, but it's so important to also look at each individual case as well. And they have, I speak to Judy and Amber almost on a daily basis, and they communicate well with one another, with me, and we all come to a conclusion, and it's a great working relationship that they have established, and I give them complete kudos to how well they do in being able to stop any cluster that has come, or making it only one case in itself in such quarters.
Well, you definitely see the positive impacts of vaccination. You see the one case at Gibbons student-wise, and 4 at the high school, and you've got almost 1,200 students there 5 days a week, actually 7 days a week. They all spend a lot of time together, and they spend a lot of time together away from us unmasked during weekends and evenings and sports. And so there's, they are living an unmasked life outside of our building, and they want to understand when they will live that unmasked life in school, which is their work environment. And, So thank you. This has been great. I appreciate it as always. We're going to see more of each other, of course, as we move through this
I
phase.
assume we will, yes. So, I think just to kind of summarize, I think the board was, I think two of us were in favor of recommending that you don't go ahead with the flexible masking policy at this time. And I think we had one board member that was in favor of, going ahead with the plan as you laid out. Is that
I would modify that phrasing. I endorse your decision-making as, reflecting what you believe is best, and I'm not opposed to it. I'm not
in favor?
recommending that particular action because I don't think it's my role right now. I understand if I was opposed to it, I would speak up. I'm not opposed to it, but the policy is a policy that is in the purview of the school department based on the data that I see. So.
And I recognize and respect that all of you echoed one singular, cohesive piece, which is the data and the information and the process in which we use that data to maintain health and wellness in the buildings would be the anchor thing that would hold us together. So thank you,
Yep.
guys.
Thank you. We appreciate all the hard work that you've put into the schools and making
Ditto.
it safe for the
Joint
kids.
effort,
It really
so.
is important, and I appreciate our
We did
ability for
we
the
did have
two
a
groups
very
to be able
successful
to
outdoor
communicate well.
homecoming. I think we had 950 students come
Yeah.
to the outdoor homecoming. And they want to be together. They want to be outside. They had it outside and they wanted to be out there unmasked. Although it was interesting is we had a range of students who masked the whole time. So, demonstrating that flexible environment, which is kids' comfort to come together and have some fun. So
I
thanks.
heard it was 995.
It might have been. It was, I chaperoned and it was so much fun. So, all right, take care.
Thank you. So we are quite a bit behind schedule. I think
It's gonna be the room, because the selectmen are always behind. Because when we were downstairs, we were never behind.
exactly. So I think the next thing on our agenda was a discussion about the library and the mask mandate that we actually had in place for the library and whether we wanted to make any changes or updates to that. Do we have someone here from the library? I'd actually like to have you start out after you introduce yourself, just giving us a feeling for what life is like at the library right now so that we can kind of figure out what we need to do to help.
Sure. Good evening. I'm Maureen Amiot, Library Director, and also here tonight is Mary Johnston, the Chair of the Library Trustees. Things are exciting at the library, like always. We have a lot going on. Since the pandemic, we've moved most of our programming outdoors, and that's been going really well. We've had programming for children, outdoor story times, playtime on the lawn, family field day. A few of those canceled due to weather, but those have been going really well. Our teen programs have been filled to capacity. Like Amber said, the teens want to be together, and we've been able to do those programs safely. We canceled all of our big fall events that we normally do, which is our annual open house, which we usually have somewhere between 200 and 300 people come through. Canceled that for this year and canceled another big event that we were planning, which was a night at the library speakeasy, which was a murder mystery event. We were hoping for about 100 people, but decided to postpone that till later in the year, probably spring or early summer, when we can see how the numbers are going. So aside from that, we've had patrons coming in. Everyone is following the mandate that was announced after your last meeting. Some of them more willingly than others. It tends to be our adult patrons that we get problems from. And I'll say probably a couple times a day, we have adults come in wearing their mask here. And when we ask them to please raise their mask above their nose, most will do so, some grudgingly, some not politely, and then others we have to provide a mask and go through the whole argument of why masks are required, why COVID is a hoax, why we have to do all of this, which, it's not every patron that comes in, but after this length of time doing this for our staff, having to be what they call the mask police that Amber alluded to earlier, they're getting worn down by the adults. And someone confided in me today that she has stopped talking to adult patrons who are coming in because there are certain ones that she knows that when she asks them to put their mask up, they're going to give her a hard time, and she just can't have the argument with this person again. So that's kind of where things stand for us at the moment. What I would like to request of you is looking at the numbers that have been fairly stable over the last few weeks since the mandate went into effect, is to allow our adult patrons and our kids over 12 or 12 and older who have been vaccinated to be able to just follow the CDC guidelines and make their masks optional when they're using the main floor of the library. We would like to still require everyone, regardless of vaccination status, who is using the children's room to be masked, no matter what age they are, what vaccination status. The mandate had been for ages 5 and up in the library, and an email that I got from the children's librarian asked that I discuss with you having kids ages 2 and up wear masks, as she's seen a significant drop-off in that age group wearing masks when it's been at parental discretion. So this is kids ages 2 to 5. She would say only 20% or less of our young patrons, 2 to 5, have been masking indoors. And since there's no timeline for vaccination for that group, she felt that including that demographic in a masking requirement would be in line with many other libraries' policies.
So I have a question. If we were to, let's say, drop the mandate and instead recommend that you come up with a library policy that you think is, good practice for the library, would you follow, those guidelines that you just said, and would that cause more problems if it wasn't a mandate from the Board of Health, but it was instead that we're recommending you develop your own policy?
I don't think it would be a problem if it was coming from the library trustees or the Board of Health. We added, I don't know if any of you have been in the library since the mandate was issued, but we did add per the Board of Health to our signage because people were asking why. And we wanted to make it clear that it was not the circulation assistant at the desk requiring them to wear a mask, that it was coming from a policy-making group. And it had the weight of either you or the library trustees behind it.
Did you want to add some comments?
Yep. Just thank you so much for bringing this up tonight. I think for patrons in town, it's a bit confusing that the library was the only municipal building that this was required for. If we're following CDC guidelines in town as responsible citizens, I think that's where a lot of the questions come from. And to your point earlier about making data-driven decisions, I think removing that mandate for the adults and teens vaccinated 12 and older would make sense, because we haven't seen that transmission at the library. And we, as a governing board of the library, are setting policies. We actually have a meeting tonight following this, and we're happy to make policies that really make sense to follow these recommendations. And much like the school, our library downstairs, the children's department, everybody there, just like in our K through 6 schools, also being masked makes sense to us as well. And given the layout of that building, it's very easily enforceable, because if most people coming into the children's library are coming in and out the Parkman entrance, and most adults that don't want to be associated are coming in and out the front.
Do either of you have comments or questions?
I have a question, which is the community room that's next to the children's library, is that being used in any way at this point in time?
We've only had one or two groups request to use it, and our meeting room policy says that groups, according to fire code, that room can accommodate 40. We've been telling them 20, and I think only one group ended up coming and using it, and it was a small group, and we told them they had to be masked the entire time.
Because again, I think if you're talking about just imposing it by floor, that floor, so the policy should require masking for people using that room.
Right.
And you also have the restrooms that are down there.
Right.
And
So we would say anybody headed down the ramp towards the restrooms, meeting room, or children's room, a mask would be required beyond that point.
So the reason that we did this in the first place and saying it was the only municipal building, we were trying to follow, the schools and do what the schools were doing, where the adults and kids were all masking. And at least that was my recommendation when this happened. I would feel comfortable if the bottom level, the children's level, remained masked. But you're asking that the vaccinated adults don't need to be in the children's, or you're saying that everybody should be?
We're saying everybody should be.
I think that's very reasonable.
So I would propose then that we first vote on whether we want to remove that mandate that we have in place. And then I would like to propose after that that we issue a recommendation to the library trustees to come up with some policy that is going to help protect the children that are in the library. And if that ends up being that first floor masks are required, the Board of Health would be in favor of that policy. Does that seem reasonable first to the library, and then we can see if that seems reasonable to the board?
Very much so.
Yeah, I guess my only comment is if it's helpful to say that this is what the Board of Health requires for that first floor, I'm more than happy to modify our existing mandate to reflect that. You seem to imply that being able to, at some point to the Board of Health as as one of the reasons, and if someone has a question as to why the library has this policy, they can certainly communicate with the Board of Health, the Health Department, and we'd be happy to explain our rationale. But if that's helpful to take a little pressure off the staff, I'm more than happy to do that.
Yep.
If it's not necessary, then what Nathan said is fine.
We're always happy to have your backup.
Okay.
I want to make a motion.
So then, I guess we've got then two options, right? One is where we just rescind the mandate, and the other is that we modify the, so I don't have the wording in front of me for the original mandate, and so maybe we will let Jennifer do some wordsmithing of our mandate that we're going to put in place. But I would like it to cover the requirement that the library in the first floor still have masking in order to protect the large number of kids that are not able to get vaccinated.
Okay. Second that?
Okay, all in favor? Aye. Okay, looks like we are going to then change that mandate for you.
Thank you. And can I also ask for your thoughts on decreasing the age of the children who are required to mask?
So if we require masking on the entire lower level of the library, that would include, no matter what age. Is there an exception then for kids that are really young?
I'd say,
Over two.
I agree with over 2, that it's unrealistic under 2, and most kids who are over 2 are already masking in certain situations, and that doesn't seem to be that much of a problem. Again, I would expect that the librarians will use discretion if you have a child who's pulling it away, who's 3 years old. What are you going to do?
Of course, but what her point was is it's hard for us to look at a child and say he might be 4 or she might be 3, but we can tell who's a baby.
Right.
And, a baby can't wear a mask, but, it's it's a little bit easier to look at them and say they're probably about 2. And like you said, if they're 2 and they're in certain situations, they're already masking anyway, and they're excited about their mask and they love their mask and they want to show you. So, that would be really helpful, I think, for
Yep.
our staff down there.
Good. And so all in favor of that age being reduced to 2? Good. Aye.
Okay.
Good. So Jen, if you can kind of put that out in wordsmith it and send it to us and, as a final approval, that'd be great.
Great, and just like Amber said as well, staying in communication with you. If you see trends in the numbers that are a little bit concerning to you, we'd be happy to communicate as much as possible so that we can keep track on anything that you're noticing that we might not be seeing.
Yep.
Thank you.
And I have been communicating. So
Yeah, we
we're
have.
for sure
Good.
continue.
Thank you very much.
And I would personally, not as a member of the board, but I would still recommend that if you're going into a indoor space and it's crowded, I'd still recommend wearing a mask. So even for those adults that might be listening that are giving you a hard time, I'd still recommend that even on the upper floor, that just they should,
Thank you.
Thank you. Let's see. I think that we've done a fair bit of COVID-19 discussion throughout the discussion of the schools. I think is there anything else left to say on that tonight? Or is there still more stuff that either of you wanted to say?
The only thing I would add is, should we reach out as a board to local churches, temples, basically encouraging vaccination for children? I don't know if that's something, I just was listening.
I can speak a little to this.
Yeah.
Because I'm on our temples committee that deals with this stuff, and there are religious schools, and so the religious schools are dealing with these exact same questions. What I can tell you is that the children tend to reflect the community that they come from, and the community has high vaccination rates. I believe that when 5 to 11 is eligible, you're going to see very high uptake of that vaccine in this community. So I think there's a lot of encouragement that's already taking place. At least that's where I come from. Whether that's true at every house of worship, I don't know. I don't know what kind of outreach we would have to them that you might have in mind. But what I'm telling you is, at least it's something that's being talked about. People have an awareness, and any institution that brings students together for either youth activities or religious education is already grappling with this stuff, because the parents of these students, are asking questions just as much.
And are we talking about doing any vaccination clinic for children?
I can answer that.
Great.
We were just approved for 1,200 doses for pediatric
Great.
COVID vaccine of Pfizer.
Nice.
And we have a meeting, the schools, Amber, the head nurse, and the fire chief have, inviting Maria, have a meeting for logistics. We're thinking of holding it at Mill Pond, since that is our highest incident rate location. I'm not sure how they're going to be shipped to us or when, but again, it's going to be evolving, and I will keep you
Great.
updated for sure.
Thank you.
Yeah. How many students are there in the Westborough Public Schools? What's the total N?
So I do not know that whole amount. That
But
are just the whole.
In that grade from 5 to 11?
No.
Oh, you mean
Total.
total? Oh, okay.
But I also
Yeah.
know that the pharmacies will also be offering it, so I'm not sure how much they'll utilize our clinic, but it's going to be available for those that would like it. We all figured that was an important step to take.
Yeah, so I think that there might be about
Okay.
200 kids per
It's about,
grade.
yeah, there's about 300,
and-
aren't there about 300 per grade?
And if you multiply
Yeah.
that by 9 to 11, I guess that's about 6 years. So it seems like the number's about right.
There will be opportunity to order more if needed. I
Great.
have to use so many in a certain amount of time, I couldn't order too much.
Good. And so this is just going to be for Westborough students, or?
Yeah, just
Yeah.
actually the students right now, we're focusing on Mill Pond, and just to see to get them vaccinated. And if we have some left over and we have the ability to order more, we'll move down to the lower grades.
Okay, good. I appreciate you following up and getting all that done, because that is important for our community.
I agree.
Let's see, so at 6:35, we had wanted to appoint the fire chief as agent of the board to conduct the BINAX Now testing for first responders. Do you want to just give a little bit of background on that? And
Sure.
then we can
The fire
make a
chief
decision?
actually reached out wanting to utilize this program, and through the Board of Health is the only way you can order it, or if we figure it would be the easiest way to order it. We did order it. We received 400 tests, and in order for him to be able to utilize these tests, he actually has to become an agent of the board, since we're the ones who are in control of the test. So this will be giving him authority to use it on his first responders.
I move that the Board of Health appoint the Fire Chief Purcell as an agent of the board to conduct BINAX Now testing for first responders.
I second it.
All in favor? Aye.
Thank you.
Excellent. So now let's get to the bistro and some of the more normal reports that the Board of Health usually hears at the start of a meeting.
So the bistro was invited tonight to attend. They chose not to. And also the owner of the building, but she did correspond with an email. I'm going to actually have Maria take over, since she's the main person involved.
So I did give some notes as to what happened with the timeline. I can give a little synopsis just to kind of refresh everybody, because there is a lot of information. So on September 15th, a routine inspection was done at the bistro. Pest activity was found. They were given 24 hours to eradicate that. I returned on the 17th of September for a follow-up reinspection. Pest control and reports were sent to the Board of Health. Everything was okay. And I told them that a reinspection would be done in 2 weeks. September 30th, I returned. There was still pest activity in the bistro. I had Jennifer come out and meet me, and we reiterated to them that pest activity was still present and that they needed to contact a pest control company again and also do a thorough cleaning of the restaurant. They were fine. They were told that they had to, again, submit those pest control reports so that we could see that, in fact, the pest control was working and the treatments were working. On October 1st, I actually met Patrick from Terminex out on site. Gary is the property manager for 57 East Main Street Plaza. He also was on site. Patrick let me know that there was significant pest activity happening in the restaurant. He reiterated to the owners that the cleaning that they had done was okay, but that more needed to be done. Some of the suggestions he made was to clean a lot of the equipment. A lot of the equipment, stoves, fryers, et cetera, are on wheels, so suggested moving those out to be able to get behind the equipment so that they could spray whatever it is they needed to spray in those particular locations, because we were still noticing pest activity in those certain areas. They agreed to do so. One of the other concerns by Greg, the property manager on site, was the dumpster out back. I went out, and it was an older dumpster, and we reached out to the Public Services and had them actually replace that dumpster because there was some issues around that dumpster, some concern of pest activity there. It just seemed like they needed a newer one, so that was replaced as well. On October 4th, the owner sent an email that everything was all set and a reinspection be done. I went down, and she let me know that the pest control had been there early in the morning, but no cleaning had been done. So I was unable to open them. There were still mouse droppings, still pest activity present. So I reiterated to her again the importance of cleaning. I know that, education is a big piece that I've found with restaurants, that, you know, you can treat all you want, but if you're not doing your own part, it's not going to help. So I said, I'm going to have to come back. You're still closed. So I went back that same day. She called and she said, you know what, everything is clean. Why don't you come back out? So that's exactly what I did. Went out. They went above and beyond. I mean, the cleaning was night and day from when I had been there earlier in the day. They actually did an excellent job. At that same time, Jennifer had supplied a demand letter to them that there was some issues with monetary fees for once, I guess there's something in Westborough where
Third and fourth inspection.
if you do more than one inspection, so that demand letter was on there that those fees needed to be paid prior to the actual opening of the bistro. On October 5th, Ray and I actually drove by at 7:45 and noticed that the open signs were on the restaurant. As much as I wanted to go in there, I refrained. I came back and discussed with Jennifer, and Jennifer actually reached out to the owner and said, you can't be open. You have to wait for the reinspection. We have to see pest control reports, the same things that we had reiterated the day prior. They spoke with Jen, said that they would be down to pay said fees. They did come down, they paid such fees. I did go back out, and they were given the okay to open at that time.
Yes. This is, I don't know if you know this, but prior, they were also brought in front of you.
Aaron brought them in front of you.
For probation, and I am requesting that you do place them on probation, just even for educational purposes.
Forget about for education purposes, I don't trust them.
No, that too. It will be better to be able to monitor them closer.
And so we do like to have the owners have the ability to come before us when we're discussing, putting them on probation. They were invited tonight and have neglected to show up.
I stressed the importance to them on multiple occasions that, the board would love to hear their side and what maybe issues they're having on their end so we could all work together. And they reiterated that they would not be present.
Okay.
So.
At this point,
I move we
entertain.
place the bistro on probation for 1 year and reevaluate after 1 year's time.
And I guess it's 22 days since the last time that you were out there. Typically, when we put people on probation, we kind of, after about 3 months, we go back for another reinspection. This might be a time where we might want to have that on the earlier side. And so I don't know exactly what thoughts are from the.
Yep, we actually already discussed that. I have not been back because I wanted to hear what your thoughts were. I agree that probation is definitely the way to go. I think going every 3 months will help too. I mean, they've had such a tremendous cleaning of that restaurant. They've had so much treatment in there that I think now is the time that, okay, going forward, this is what you need to do, because I think we can't let it get back to what it was when I first went in there.
She will be going back next week to follow up.
Okay. So do we have a second then for putting them on?
Second.
Yep. So all in favor? Aye.
Thank you.
So they're officially on probation. Let's see. I think that there was a discussion here about information between board members and the health director. So Jen, I assume this is something that you wanted to address? Or?
Yep. I think that more communication needs to be taken on what you expect to be given information to the board and what I'm comfortable with. And also, the communication I've given you this month is probably a good example of what I would be communicating. So if there's more, that's definitely something I would want to know and hear, and maybe we can discuss. And I'm not sure if you're looking for.
This is more of a question from you to us asking, is there more stuff that we would like to see and to let you know?
I think, again, Jen's new here, and so one of the, there are a number of issues, whether it be COVID, communicable diseases, typically the restaurant closures, whether it be for health-related stuff, or there's a fire, or there's a power outage, or things like that. These are the things. So as these things happen, how much do we need to know about it in real time? How much in a weekly report? How much, via email? How much just at our monthly meetings? I think that would be helpful for, again, it's a new board, and just to clarify, what are reasonable expectations for, what we want to hear, as much as, what's reasonable for Jen to produce for us.
So I'll open it up first to you guys, and then I'll comment too.
I mean, I had reached out to Jen because I had heard from friends about the Mill Pond cases in the office, the administrative office. And I had been surprised that I hadn't heard about it through the board. So it wasn't students, it was staff, but I had people reaching out to me, have you heard that a bunch of staff at Mill Pond, have COVID? And so that came up with me, I think with the pandemic, and I think that would have been helpful for us to know as a board, but.
So I have a concern with that, because if I release that information, it's identifying information on whom these COVID positive cases are. So if I said the front office.
But it went out to all the families in that school.
Right, and I, at that time, wasn't aware when we got the positive. And also, it's not my place to release that. If they feel free to want to release that, it's not my place, I don't feel, to release that information. I believe in protecting personal, information, and that's my.
Okay, I guess, is your concern saying, well, it was so-and-so that, the principal, versus saying, okay, there were 3 staff members and 2 students, or something like that?
Right, which I do believe was reiterated during that report. I would not have chosen to reach out and say, this office has now, have an outbreak, so I'm not sure, or a cluster.
I disagree. Having parents reaching out to me personally and being shocked that I didn't know about it. The vice principal is the one, he wrote the letter to the whole school and told all the families that it was him and the principal and another staff member. But so that's how I heard. She was, forwarded me the email.
And I had no idea.
We weren't notified. You got the notification. We didn't.
Yeah, so I'd say that there obviously is a fine line there. I think that when something might be a large enough incident that we're going to hear about it from some other means, it would be good for us to at least hear the general information from you before we start hearing about it from, other sources, because then it makes the board look a little uninformed. But I'm not saying that we need to know all the details, but just saying that there's something, there were a high number of cases at Mill Pond, and just kind of leave it at that. That's the sort of thing that then when we're, fielding other comments from other people, I don't want you to give me more information than I need, because as soon as you start telling me, privileged privacy information, there's then the risk that I'm going to give it out, which I don't ever want to be in a position of. And so I try to take great steps to not know the detailed information. But for me, it is worthwhile to know that something is going on, so that then when, my neighbor stops by and says, I can't believe what just happened, and be like, oh, I haven't heard anything about it. Just from that context, is where I stand. Maybe Alan or Melissa feel differently about, the level of knowledge that they want. If you want more information, you are going to have to censor yourself, realizing that the Board of Health does get private information that we have to keep private. And we aren't even necessarily allowed to confirm stuff that is a suspicion from someone else, because then we're actually giving away privacy information that we shouldn't. So it's that fine line. But in terms of us knowing that there's something going on, it might be good. I would say that, do I need to know about every single case? No. If there's I typically look at the weekly reports on, Thursday or Friday, And that's the basis for where I'm keeping up with the COVID cases. And so as long as it makes it into the report, usually by Friday, I know, if something happened on a Monday that people you thought in town were going to be talking a lot about that we might need to know about, just so that we sound informed, then, I'd argue that maybe that would be a sort of case where I'd want you to reach out to me.
I think the schools are a particularly sensitive subject, as I think we've all gathered from the last week. And I think it's not unreasonable to make a request to the schools that if they are sending communications about COVID-related matters to one school's population or to the entire school-age population, either way, that you be copied on all those and anything relevant that you then be able to forward to us.
Okay.
I think that would go a long way towards what you're saying.
Yeah.
And
That's all I'm asking, absolutely.
And then I think it's just in terms of other types of information, when it comes to like the bistro or somebody else, your emergency closure due to a water main leak or something like that. We have a very talented group of people working for us, and so you guys can handle almost any situation that's coming up. When you come across a case that you're looking for guidance for, or that is kind of some extreme case, that's when we can be notified. But I think most of the other times, I'm perfectly happy with the current amount of notification we're getting.
Yeah, I agree. And if you're gonna shut down a restaurant for any number of reasons, you've got a lot of things you're focused on, and if we find out about it a day or two later, I mean, that's I think that's fine.
I try to let you know about that immediately, I do. That I have no problem with.
That's real visible, so we want to make sure
Yeah,
the
and
visible
people-
things that
yes.
people see, a sign on the door, they're going to call you and say, hey, why is that closed?
Yeah.
And you're like, oh, yeah, it's being taken care of,
Well, as Dr. Ehrlich said, I think we get more calls and emails from things related to the schools than we do for an individual restaurant.
Yeah.
so.
Mhm.
Good. Let's see, and then, so we have to approve the minutes from the September 21st meeting. Do either of you have comments on that?
No.
Do I have a motion?
I motion to approve the minutes from the September 21st meeting.
Second that?
All in favor? Aye? Okay, director's report.
I don't have any questions.
Melissa, do you?
No, I do not.
I move we accept the director's report for September 2021 as presented.
I second it.
All in favor? Aye? And then, let's see, the sanitarians report?
Yeah, I had a question about the case of varicella.
Yep.
First of all, was this a young child who yet to be immunized, or one who wasn't immunized?
It was immunized.
Was immunized?
Really?
Yes. I talked to the father and I talked to the daycare, and they both said that the child had been immunized.
Interesting.
Yeah. Well, by one shot, right? Just the one. Wow.
Anything else on the sanitarians report?
No.
No. I make a motion that we accept the sanitarians report then?
Second?
All in favor?
Aye.
Aye. Health inspectors report? No. Okay, I make a motion that we accept the health inspector's report for September.
I'll second that.
All in favor? Aye? Looks like everyone's unanimous there. Okay, director's issues.
So I do think it should be mentioned about our certificates of merit and
Yep.
who had received them in September. And it was El Basha, the Perk and Parcel, Chick-fil-A's, and Wendy's. So they will be receiving those certificates in the mail. We are starting to do that again. It was stopped a while, as you know, because of COVID. So we're looking forward to get that going again. So we are hoping to change our reporting to you from monthly to meeting. I think that you having the most updated information rather than older information would be more beneficial. And I think it'd be easier for us to create the reports for you. Again, I mean, it's not, we've been doing it. It's fine to continue the way we have, but we just want you to think and discuss, if you would.
If I can chime in on that, in the past, we'll giving you something from, like, I know in the past with Erin and I, we'd be, oh, this is have you gone back? So now you'll have that right up to date, and I think that'll help you out with when you're reading the reports too.
So I guess the question is, when would be the close of?
Thursday.
deadline? So is it time the minutes are, I mean, because obviously you need time to prepare your report. So, you know, if it's the Monday of the week that you're sending out the packet or something like that.
Well, I think we want to
We-
get it to you.
Yeah, we want
so-
to get to you in your packet, so it'd be that Thursday you receive your packet, or Friday, whichever one it is.
So it would be
So
the
if
Thursday
we-
before the meeting, so 4 days before the meeting, we'd all be caught up. It'd just be the weekend before the meeting, you wouldn't have information.
That you get, okay, I mean, it's fine by me, but it seems like it puts a little bit of pressure on, yeah.
The two of us.
Right. And I'm trying to be a little more realistic, like.
Yeah, thank you.
But I
Yours are
actually-
easier.
I actually agree because, you know, so for example, we had the bistro, but then I just closed another restaurant. And so now to have to wait till next month, it's going to be so far.
You know about this restaurant.
Yeah,
Yeah.
right. No, I know that.
So it just seems appropriate that we discuss what's happening
In the moment.
in the moment as opposed to, oh, well, that happened last month, but we're going to talk about it now.
And we did discuss this between the three of us. We write down things as we complete them, as we go. We
Okay.
try to, anyway.
Try.
So creating one at the end would not be that
It
much
would make me
hardship.
do it every day if I knew I had to have it done by a certain time.
Well, okay, again, I leave it to you too, but normally what I would say is if we're gonna have a meeting on Tuesday, make it current through 1 week before. Give yourself a couple days to, you know, deal with stuff, but I don't know if either of you,
I'm fine, as long as it's clearly dated, and probably what you want to do on the reports is have the time frame. So
Yep.
that normally we refer to it as like the September report. We might have to have it be the September 18th through October,
Yeah.
you know,
Mhm.
Yep.
14th
Mhm.
report.
And we'll make sure all our dates are the same.
As long as there are no gaps.
Yeah.
So that like, you don't only go up to Tuesday from one report.
And I'm
but
gonna
then the
leave
next
out
one
all
doesn't
this
start
extra
till-
stuff
yeah.
that I don't want to tell you.
Exactly, yeah. I just want to make sure that we don't lose days.
Perfect.
But if that makes your life easier, I think it will help reduce the number of questions that we ask you about, you know, what the
And
follow-up.
then we're trying to remember what we did 30 days ago.
yeah.
Yep.
Okay, next one. Sam and VNA is conducting their last interview on Thursday, and we should meet our public health nurse next week. I hear great things about him. He actually worked the clinic. He's a
I'm
fire-
sorry, I missed the very first part of what you
I'm
said.
sorry.
Sam and VNA, this is our shared health services.
Oh, yes,
Yeah.
okay.
Yeah,
Yep.
sorry. He actually worked a clinic. He's a fireman in Hopkinton. And so we're familiar, some people are familiar with him, and I hear great things about him. So I'm hoping that works out. The contact tracing grant, as you know, the CTC is ending. We're not allowed to send any cases to them as of November 30th. And so we applied for the contact tracing grant for an additional funds for our region in the amount of $345,000, $437.50. The grant requires that they include at least one epi, which is the salary of $65,000 a year, and also request for 1.5 full-time public health nurse with a $75,000 full-time salary, as well as fringe benefits, administrative fees, and equipment. DPH could reduce the request or deny or approve fully. They have over $5 million in funds to support the contact tracing for our region, and grant awards will range from $60,000 to $400,000 according to the RFR.
Is this for our regional collaborative, not just the
Greater
town?
boroughs, yeah.
Yep.
So we will find out, we did find out the contact tracing grant we applied for has been approved. by word of mouth. We have not received anything written yet, so we're not sure if they've cut anything or if they've added anything. With the Public Health Excellence Grant, the Contact Trace Grant, we'll have a full-time public health nurse here in Westborough, which I think is fantastic. In any event of surge of cases in any one community, it was agreed upon that the nursing and epi staff will appropriately share cases to make sure the highest risk, such as seniors, assisted living, and daycares and schools, are contacted first. The new contact tracing grant states that if 100% of the contact tracing is done, the nurse and epidemiologist can take on other health department tasks in our communities. It's an incredible opportunity to expand our public health programming, so we're looking very much forward to that. So those are the only announcements and concerns that I have.
Can I add something that was on your list?
What?
No, just about the report that I do weekly for COVID.
Okay.
No, it's nothing.
No, I don't know.
So, well, it's something I thought about because I was listening to everybody speak and I was taking down numbers and everything, and we're talking about community spread and everything. So, and I remember you mentioned Hopkinton and 98% and everything like that. I've talked to Sean over the last few weeks about what he's doing. I believe Sean is the director
In Hopkins.
in Hopkinton.
Okay.
So we met at the clinics and we talk every once in a while. He'll send me an email if he has a question and I go back and forth with him. So one of the things I did note is that Westborough has more congregate care facilities than anybody around us. And this week, when you get your numbers on Thursday night, when you get the numbers on Friday, they're published, we have a large number from a locked facility that they're not out in the community. But we still count those towards our numbers, which shows us, it shows the number that you're showing is a higher number, like that 26 or 23. But if you say that they can't leave because they're locked in a locked facility, the people who are taking care of them are fully masked, fully gloved and everything, they're not in our community. So it kind of throws our numbers off of those towns around us. And I just want, when you guys are looking at the numbers, to realize, look at that number that says congregate care. Because those, like,
We actually have 10 this week.
yeah, we had 24 cases as of today. 10 of them are congregate care, so they're not out in the community.
So
Can we,
sorry.
go ahead.
Yeah, so some congregate care is people who can come and go.
Yes.
And some isn't.
And some isn't. And the ones that we've had lately, if you look at the last 3 reports, last week there was no congregate care, but I think the week before that there was 3. They're all because I see all the cases come through my desk. I see all the
And
addresses.
myself.
So I get them to you, yeah, I
I
go.
have access to the
Yes,
as well.
but, so I'm the one accepting the cases, and I'm the one sending the ones to CTC.
Without worrying about where these particular cases are coming from, which facilities in our town would you include in what you call locked facilities?
We have 2 juvenile locked facilities that are juvenile detention centers, really. We have the female and the male over by the lake.
Yep.
We have, one of the spectrums is, one of their floors is a locked facility. And if someone gets COVID, they go into this locked area and they're not allowed to leave for the 10 days. That's they can't keep them there, but they impress upon the fact that they can't leave. And I'm in contact with them as soon as I get the cases, and they said, yep, they're all on the COVID floor.
Yep.
And we're keeping them away, and they're getting their meals in place and everything. So they're not having contact with the community. So some of those cases, I think it skews our numbers a little bit, just because, and I have 4 juvenile homes that are autistic children that in the past we had, like, the whole house we had 11 from one house. They get transferred to school together, they eat and they live together. So in the past, our numbers have looked high because we have a lot of congregate care. And I think just something to keep in the back of your head, yes, our numbers are a little bit higher than I want to see them, but I think the congregate care, when you see those numbers, you got to say, oh, wait, they're not in the community.
Is there a way to break that apart, or do we not
Well, we
wanna-
do, when I have congregate care, it's there. I haven't put a couple of the homes, like, because I know
Those or something?
the nursing home, they can't leave, but the families can come in, but if they have COVID, they can't, like, the ones who are in independent living, I put those as congregate, just in the regular thing. Community, because they do have ability to leave and go, stuff like that. So I just wanted to, because I was listening to all the numbers and everything, and I was like, geez, when I talk to Sean, they don't have that in Hopkins
Yeah,
like we
it's
do. So
interesting.
it's just something to keep in the back of your head. I mean, I understand the numbers are concerning, but there is that little bit. So when you see that number, it says congregate care. So if the number says 24 and it says 10 down here, congregate care, that means there's 14 in the community.
Another question about this is, I want to get this exactly right. The numbers for the congregate care, are these transient, like, are they the same people, or do these facilities have people coming and going?
30 to 60 day stay is the normal.
Okay.
So I look up every person that comes in, they come in with the address for the facility. I go into MIIS and I look, we have people from Chelmsford, we have people from Roxbury, we have people from all these other communities who are in town. So they're because of where they stay, that's what their address is considered to that, so.
But the point is that why we keep having cases, if there's turnover and you keep bringing in an influx of people who are unvaccinated.
That's the problem, is out of those 10 cases in the congregate care, only 1 is vaccinated, 9 are not.
Okay.
Wow.
And that's the issue, as I've been talking with her about, is how come that, she goes, if they are sent there from the court doesn't care if they're vaccinated, they send them there. They say, oh, you have a COVID unit? Test them and put them in the COVID unit.
Got it.
And that's what's kind of happening with them.
All right.
So I just wanted to put that in the back of your heads when you're looking at numbers,
Thank you.
that's all.
Thanks.
So I think especially as we compare across towns, that's very
Yeah.
important. I think if we're just comparing to where we were last week, or, a month ago or a year ago, we've had these facilities, it's not like these are new facilities.
No, but I think the numbers have all been, like, this week, if we didn't count the congregate care, we'd have 14 so far, and we have 24 hours left before I do the report.
Yep.
So, and usually we're getting 3 to 4 overnight.
Are
So-
they trying to vaccinate these people?
They
are.
They
I
are,
assume they
but
are, but.
they're adults, and adults say
Yeah.
no,
Yeah.
they can't do much about it. Some are court appointed, like they're
That was
sent
me,
there by the
sorry.
court, some go on their own.
That was me.
And it seems to be more of the ones that are getting are the ones who are court appointed, who are sent there because of the courts. So that's the issue we're having there. And we had, 2 weeks ago, I had 5 cases in one of the juvenile detention facilities. I had 4 cases that were employees. I was able to ship them off to the towns they belong to, because a lot of them, they come in and it's, especially at there, we have, when I look at the ages, I'm like, okay, he's 38 years old, he's not a resident. So now I go searching to find out what town he lives in, and I ship it to that town. So we aren't getting those numbers. But because that's where it was first reported, sometimes those numbers come out in the state numbers. So that's why we have that little influx where our numbers might be a little higher or a little lower. It's because, I transferred him over to Shrewsbury where he lives, but the state had already counted as one of our numbers.
Okay.
So that's where we get the little bit. So our numbers don't fluctuate all that much with 1 or 2, but I just want to keep everybody aware that there are other reasons that we're higher than other towns.
And as far as the juvenile detention facilities, and us being able to get doses of vaccine for the, middle school age group, is there any ability to help the juvenile detention
That's the
facilities get
state,
vaccines?
that's the state.
As I recall, when we had the vaccine clinic at
We had the employees.
the Doubletree, okay, the employees came over.
We had
So
employees that
okay,
came
fine.
over from there, because
Yeah.
the state said they had to get it through them, but then they slowed it down, so they came to us. The children that are there, a lot of them are between the ages of 13 and 18 in one of the locations, and they can't come out and get it, and the state said they won't send anybody in, they'll do their own. They don't want locals to do it.
All right,
That's unfortunate.
all right.
He asked, thank you.
We were talking about a meeting next month?
So I think that we, that works for me. I don't know if it works for you too.
I'm sorry, which day were you speaking of?
November 16th? That's the third Tuesday.
It's fine with me.
Yeah, thank you.
Excellent. So we'll do that. Do we have a motion to adjourn, or is there anything else that we need to discuss?
I move we adjourn.
Do we have a second?
Second it, sorry.
All in favor?
Aye.
Thank you.
Thank you.
Lock the front doors.